Whether you live in Somalia, Senegal, Nigeria, or Zimbabwe, from every corner of sub-Saharan Africa, turn to us for information and experts to help you improve health and life, for you and your family, for your health. Africa Health Network, only on VOA.
The Voice of America Africa Health Network can really expose all of African people around the world to issues that have to do with world health. I'm very excited about it.
What it provides is the opportunity for health issues to be constantly on the media agenda.
Africa Health Network is a welcome move.
We need to bring more information to the public.
Hello everyone. Health officials in Zimbabwe say more than 100 people have contracted typhoid this month in the capital Harare and the town of Chitungwiza. Officials say they are closely monitoring the situation to prevent the typhoid outbreak from spreading. The country's dilapidated water and sanitation systems are being blamed for this latest round of waterborne diseases. The Zimbabwe government recently announced that it will spend $60 million rehabilitating and upgrading the nation's water and sanitation systems.
American obstetrician Laura Stachel was appalled by the lack of light when she first visited Africa in 2008.
In the middle of the night, very often there was no light whatsoever, and they were using kerosene lanterns to try and examine patients with severe medical conditions. I was watching a C-section where the lights went out, and the doctors had to finish by my own flashlight. That was the only lighting available.
Dr. Stachel turned to her husband to help her come up with a solution.
My husband is a solar educator and an innovator, and he said, Laura, when you come back, maybe we can think of something to at least help the electricity situation in the hospital. So together, when I got back from Nigeria, we thought about what could we do to make a difference in this one hospital. And we thought, well, we could use solar electricity because the sun is a free source of fuel.
They began with large solar panels put together in their backyard. Today, suitcase-sized kits provide the power of light to almost 200 clinics around the world.
I asked my husband if he could put together a kit that was small enough for me to fit into my suitcase so I could slip through customs easily. And I also didn't know a lot about solar, so I said, could you make this easy enough for me to use so that put together everything you can so that I can just put together a couple of wires at the end and show them what to do. You will have a way to charge headlamps.
On a recent training trip to Nigeria, Stachel's suitcase of reliable power was well received.
We'll be very happy, and everything will go on smoothly. And now we will try more and more.
It is early morning in Kumasi, and thousands of people have gathered outside the Baba Yara Sports Stadium. They are here for the second annual Susan G. Komen Ghana Race for the Cure with the theme, Get Involved, Together We Race for the Cure. Created in the United States by the Susan G. Komen Foundation, the event is one of the world's largest to raise awareness and support for breast cancer. The race was introduced in Ghana last year by Breast Care International, a non-profit organization dedicated to the establishment of breast cancer awareness centers throughout the country. Dr. Beatrice Wiafiadai, the founder of Breast Care International, says it was timely to bring the race to her country.
Breast cancer is killing a lot of women in Africa, and so Breast Care International saw it as timely to get involved with Susan G. Komen for the Cure, to come and help us organize such a race in Ghana on the African continent. It's a global fight, and we want to be a part of it to help save our women from dying this untimely death. Where a woman lives should not determine whether she should survive breast cancer or die.
Congratulations for launching the Africa Health Network.
I congratulate you to start the African Youth Network and kindly work with the implementing partners. Find out who is in the region so that then you become relevant.
Kudos to you and continue the good works you're doing.
People with disabilities are forgotten, so if you can reach them, you'll be reaching the whole world.